Perfect. All righty, perfect. Thank you so much.
You're welcome.
And what's your first and last name and your title, if you can spell that for me?
Cathy Maddry, Cathy with a C, Maddry. My title is Assistant Dean of Nursing.
And so recently, yesterday in a presser with Ochsner, they spoke about how there's a shortage of healthcare workers, specifically being nursing. What does it look like at your program?
We're doing our best to try to help meet the needs of the community, and we've recently increased our enrollment because there's just such a horrible demand for nurses. You know, they're leaving because it's so stressful, and they're leaving their jobs because it's so stressful, and so we're just trying to help provide some more nurses to fill the need.
And what was your admission number before changing it? And when did you guys decide to change?
I believe we first increased our enrollment last fall, and we can only increase our numbers by so much because we have to have, adequate staff and adequate facilities. But we took let me go back 3 years. 3 years, we would take 40 students, and then we would take in 10 LPNs on top of it. Now we're taking 60 students and 10 LPNs on top of it. We have an LPN to RN bridge program. So this fall we have a total of 70 new admissions, and we admit every spring and every fall. So we've incrementally gone up every semester about 10.
And so are you seeing more people interested in coming into the field, especially, during a pandemic when there's more stress,
There doesn't seem to be a whole lot more applying for it, but we've to get in the program, but we've always had a lot of people that we couldn't take. So since we've increased our numbers, we're taking much more of the people that are qualified, or I should say many more of the people that are qualified.
And what does it mean to be a nurse, right now, especially during a pandemic?
These are just unprecedented times, and it's affected nursing education. It's affected nursing. People have to really examine themselves. Why are they going into nursing? Because you cannot come in and say, well, I don't want to take care of a COVID patient. Nurses don't have that choice. And I know this is a little bit off, but we helped administer the vaccinations back when they were doing the drive-through vaccinations out at the fairgrounds. So it's changed our role a little bit in education and in training. I mean, just trying to help the community because of the pandemic. What can we do just as a college to help the pandemic?
And how do you kind of teach students to cope through, what's going on? Like you said, things have kind of changed. So what has changed as far as curriculum and how you tell nurses how to deal with this? Because in the beginning, there wasn't a plan book for this.
There was no plan in place. That's true. But, nurses are highly adaptable. We're just upfront with them. You have to decide if you're willing to take that risk. And of course, now that the vaccine is out, that definitely decreases the risk of severe illness. But there's people who choose not to take the vaccine. So it's all about a matter of whether or not they're willing to accept the risk that is involved with nursing. And I truly believe if you're meant to be a nurse, you're not going to be happy doing anything else. So, you have to find what you're happy doing and decide if you're willing to take that risk.
And did you guys have any impacts as far as last semesters with people kind of second guessing because they were in school during a pandemic? Because I'm pretty sure a lot had to change as far as being face-to-face last year.
I think that some especially before the vaccine, a lot of students were really skittish about it. And honestly, I mean, we weren't wild about the idea of it, but, you know, we told them we just have to do what we know. And we had to wear our N95 masks and our PPE and protect ourselves and do what we had to do. And they really did beautifully. They really did. I'm proud of our students.
I mean, more power to them. And I appreciate them for going out there and doing that for sure. And my next question is just going backwards to what hospitals are saying the need for nurses. You know, how big is that need?
Every hospital, every single hospital. And, you know, in our area, we have Ochsner's is always looking for nurses, Willis Knighton, Christus, the LTACs, like intensive specialty hospital, and all of them, even the nursing homes. We started an LPN program also to try to help. You know, we've never had an LPN program before. We started it in January, I believe.
This January?
This January. Wow. It's a brand new program.
Okay. So let's talk about that, because that's awesome. What made you all start that, especially start a new program during the pandemic?
We started out trying to start it before the pandemic, but the pandemic helped us realize how desperate our community is for more nurses. And it's rolling right along. It's a night and evening program trying to help meet the needs of the working person. And in fact, we've added a subcategory of our LPN to RN. We've developed a new curriculum that enables them to work full time and just come to school one day a week and go. It takes a little bit longer, but that way they can keep working, keep supporting their families, keep taking care of people while earning their RN.
And what are you looking forward to most this school year? I know that you guys will be helping out the hospitals, because do they do their clinicals at the hospitals too as well?
Yes, ma'am.
So that will also be a way to give the hospital a hand for those who are newly in school, correct?
Right. It's, you know, nursing is one of those things that you can't just teach it in class. You have to it's hands-on. You have to learn how to touch a person, how to take care of a person. And there's no substitute for that. You can watch all the videos in the world. That's not going to prepare you for the real world. And so we've been going to the hospital. The only time that we were not able to go was right in the spring of 2020 when it first got bad. The hospitals weren't letting any extra people in. PPE was in short supply, but once over the summer, everybody was able to get plenty of masks and everything. And last fall, we dove right in back to the hospital.
And a last question, as COVID cases continue to rise and hospitals continue to get overworked, how will your students this year be able to help attribute to those hospitals and give them an extra hand?
Well, we'll be going to the hospitals the second week after our semester starts, and we'll be going all the way through the semester. We definitely provide a helping hand to the different floors, and they're always glad to see us come and help them out. And I hate that they're just so short-staffed. My heart goes out to them, because it's got to be scary as a nurse responsible for those patients when you really just don't quite have enough help.
And you've been doing this for a long time. Have you been through anything like this before?
Never. I've been a nurse for 40 something years, and this is truly the most challenging times I've ever seen for nursing.
And I appreciate your time today. Is there anything else that you'd like to add?
I just I wish more people would get vaccinated, like so many people say. There's so much misinformation out there about it, but it's truly the main thing that's going to help with this pandemic. And you know, we all got our shots, and we all expected to have side effects, and it was scary because we've read all these horrible things, but we're all good. We're all good. Nothing happened to anybody.
And that's true. So I got my vaccine. So
Oh, I'm so proud of you.
well,
You
I'm
don't,
around a
that's
lot of people, so I
my
have
heart.
to. I'm like,
That's that is such a wise thing to do when you're
yeah,
around people that
it's scary and it's real, you know. With I can't preach it and then not do it. So but
right. Well, you know, here's the thing. People do, I respect their choice. I really do honestly respect their choice. But if they could see what COVID does to a person, and if they could see a young person struggling to breathe, or a young person that doesn't make it, you know, it hits home. And I would rather take my chances with that vaccine than take my chances with the COVID, because it doesn't play games. It's no fun.
and you're totally right on that. So I agree. If we can get more people, if I have to do a COVID story every day, I'll do it.
There
But
you
thank
go. I
you
appreciate that.
so much for attributing to my COVID story that I'm doing. So thank you.
You're very welcome, Taylor.
Well, have a great
Anytime.
day.
You
Bye bye.
too. Bye bye.